Hello, everyone. In order to promptly and accurately assess the injury and treatment conditions of individuals involved in various accidents, and to ensure the effective implementation of emergency medical rescues, it is necessary to strengthen the management of emergency medical rescue reporting for sudden incidents. In this lecture, we will learn about the report on medical and health rescues and accidents, which includes the following content: the purpose of the report, the reporter or reporting unit, the content of the report, the reporting procedures, the classification of medical and health rescue events, and the reporting time limits. First, let's learn about the purpose of the report. The first purpose is to send out a distress signal and obtain medical rescue. After a sudden accident, survivors at the scene should immediately report to the emergency center and their respective superior departments to send out a distress signal. This ensures that medical rescue can be quickly obtained, safeguarding lives and reducing casualties. The second purpose is to promptly understand the disaster situation and rapidly organize rescue efforts. The emergency center or relevant units should promptly report the disaster situation to the higher health administrative departments and the local government. This ensures that the higher health administrative departments and local government can quickly understand the situation and organize rescue efforts according to the rescue plan. They should also promptly report the progress of the rescue to the higher health administrative departments and local government. Second, let's learn about the reporter or reporting unit. After a sudden accident occurs, it is the responsibility and duty of every unit and individual citizen to promptly dial 120 to report the incident to the local emergency center, station. This ensures the quick gathering of accident information. The emergency center, station, as the professional emergency institution of the local government, should be informed of local distress signals and accident handling situations. It should promptly report to the local government and health administrative departments to facilitate the unified organization, coordination, and management by government leaders. If the local government has not yet established an emergency center, station, distress signals and accident handling situations can be reported to the local hospital. Upon receiving the distress signal, the hospital should not only quickly organize the rescue but also immediately report to the local government or the local government's hotline. If the reporting capability at the accident site is lost, the neighboring district's government health administrative department, medical and health unit, or medical personnel should carry out the reporting procedures. Third, let's explore the basic content of the report, including the initial report, progress report, and final report. The initial report should include the time and location of the incident, the type of event, the number of injured or sick individuals treated and admitted by medical institutions, the classification of injuries, the medical rescue measures already taken, and whether support from higher health administrative departments is needed. The progress report should include the number of injured or sick individuals observed in outpatient clinics or hospitalized, their injury classification and prognosis, the distribution of patients in different hospitals, and further medical rescue measures. The final report should include the overall condition of injuries and illnesses resulting from the sudden incident, the overall progress of emergency medical rescue efforts, problems encountered and lessons learned, as well as measures and suggestions for improvement. Fourth, working procedure of the report. 1. After receiving a report of a sudden accident, the medical emergency center, station, and other medical institutions, while promptly carrying out emergency medical and health rescues, should immediately report the casualties, rescue situation, and other related information to the on-site medical and health rescue command center or the local health administrative departments. 2. The on-site medical and health rescue command center and the medical institutions carrying out medical and health rescue tasks must report the status of the injured, the progress of medical treatment, and other information to the higher health administrative departments on a daily basis, and report important situations as they arise. Relevant health administrative departments should promptly report the relevant information to the local people's government and the Emergency Response Command Agency for sudden public incidents. 3. Health administrative departments at all levels should carefully manage the release of medical and health rescue information related to sudden public incidents. 4. The Medical and Health Rescue Command Center should summarize the rescue operation and report the outcomes to the higher authorities after the rescue is concluded. 5th, classification of medical and health rescue events. Based on the nature, severity, and scope of the sudden public event, medical and health rescue events are categorized into 4 levels: specially major, level 1, major, level 2, relatively major, level 3, and general, level 4. 1. Specially major events, level 1. These include 3 types. 1. An incident causing more than 100 casualties, with many critical injuries, or a nuclear accident, sudden radiation event, or chemical leak resulting in a large number of casualties. 2. A sudden public incident causing particularly severe casualties across provincial, regional boundaries. 3. Other specially major sudden public incidents, as identified by the State Council and its relevant departments, requiring medical and health rescues. 2. Major events, level 2. These include 3 types. 1. A sudden incident causing 50 to 100 casualties, with more than 5 deaths or critical cases. 2. A sudden incident involving severe casualties in 2 or more cities at or above the prefecture level or provincial directly governed counties, cities or districts. 3. Other major public incidents, as identified by provincial governments and their relevant departments, requiring medical and health rescues. 3. Relatively major events, level 3. These include 2 types. 1. A sudden incident causing 30 to 50 casualties, with more than 3 deaths or critical cases. 2. Relatively major sudden public incidents, as identified by the people's government and its relevant departments in a city at or above the prefecture level or a provincial directly governed county, city or district, requiring medical and health rescues. 4. General events, level 4. These include 2 types. 1. A sudden incident causing 10 to 30 casualties, with more than 1 death or critical case. 2. Other general public incidents, as identified by county-level people's governments and their relevant departments, requiring medical and health rescues. 6th, reporting time limits. 1. Local health administrative departments at all levels should immediately report any medical rescue information for specially major or major sudden incidents, or for incidents occurring in sensitive periods, regions, or populations, to both the local people's government and the higher health administrative department. In emergency situations, they may first report a brief summary via phone or text message, followed by a formal written report. 2. Reports for medical and health rescue information on relatively major level 3 or general level 4 incidents should be made according to the relevant plans and regulations. Alright, that concludes the key aspects of the report on medical and health rescues in accidents. See you in our next lecture.